It was 12 years ago when a crucial and very important event happened to me and my family. That was when my dad passed away due to a complication of being a diabetic for more than 12 years, and suddenly he developed an acute renal failure, and he died due to a very bad infection. And from that moment, that was very intense for me, but at the same time I got focused on treating my patient from a different perception. After that, I started to learn more and more how to develop better options for patients who suffer certain conditions to try to bring them back to a healthy state. So it was 12 years ago when I started, due to the most crucial and sad event I ever went through in my life. It's a mixture of emotions, the passion I have for innovation, but at the same time, the saddest moment of my life. So that created what I'm doing today, which is targeting only the best options regarding treatments to my patients, because they deserve better, in the same way my dad deserved back then, but I didn't know about it. So now that I do, I apply everything and all the knowledge that I have learned through the past years. And from that moment, I decided to become innovative medical procedures and targeting something special, because a lot of people have no access to these kind of medical treatments. Nowhere in the world. So compassionate medical use. So we created a whole and a complete strategy to bring these options to patients, like my dad, who didn't have an option, but back then, 12 years ago. Getting into that competitive edge, we decided to treat patients with special conditions, which are patients suffering spinal cord injuries, major ones, Asia A and Asia B. And from that moment, we got totally focused on the benefit that the combinatorial biologics we're creating and having here in our practice can bring to these patients. The translational medical applications we're doing with them is quite unique in the world. And we're combining Bioquantity, which is a patented polypeptide that we are isolating in our lab in the US, also with mesenchymal stem cells. So Bioquantity, or patented polypeptide, contains 93 peptides, and it's quite unique because its origin is from a specific amphibian that it's known in nature as Xenopus levis. The Xenopus levis can regrow a complete limb, but also all the tissues within, connective tissue, obviously bones, nerves, skin, even brain tissue. In that moment, we decided to use the polypeptide combined with mesenchymal stem cells to treat no-option patients regarding spinal cord injuries. We learned that we can apply those treatments as well for patients looking for longevity. People may understand longevity as well as anti-aging. Anti-aging has certain kind of varieties within the term. People may get confused about aesthetic procedures, plastic surgery, and all the kind of cosmetic as well procedures. To us, longevity is not only that, but also patients regarding and targeting live longer without diseases, which is the main purpose of longevity. Becoming an opinion leader, an international speaker, and also considered a professor on the field, traveling worldwide, talking about my protocols and all the innovative stuff we were doing since a few years ago. We chose Cancun because people can have access to Cancun very easy from Europe, from North America, from South America, from Central America, even from Asia. So it's a worldwide destination, and it's a very safe place to come. In traveling the world, I've visited more than 70 countries and more than 200 cities. And I'm confident when you come and see us in Cancun, you'll feel at home.